Body fluid 2, part 2, electrolytes. Chemically, electrolytes are substances that become ions in solutions and acquire the capacity to conduct electricity. It's present in the human body, and the balance of the electrolytes in our body is essential for normal function of our cells and our organs. ولهذا electrolytes is very important. زين إذا ماكوش بيها بالانس واضح between the presence قد النسب مالتها بالسيلز وخارج السيلز body functions are affected. Fluid balance is linked with electrolyte balance. Electrolytes are chemical compounds that dissociate in water to form charged particles نسميها ions. نسميها ions. They include potassium, sodium, chloride, magnesium, and phosphate. Electrolytes are either positive cations نسميها or negative anions. البوزيتيف هي الصوديوم والبوتاسيوم مثلا أمثلة عليها. النيجاتيف are chloride and bicarbonate. The composition of electrolytes differ between the intracellular and extracellular compartments. The function of electrolytes, the main functions of electrolytes, enabling the liquid to conduct electric current, regulate fluid movement between the compartment, regulate hydrogen ion concentration for normal cellular function and for other biochemical reactions, play a vital role in the membrane potential and action potential, essential for neuronal function. One of the important electrolytes is the sodium. ايش قد التركيز مالته بالhuman body is 135 to 145 بالسيرم. بالسيرم هذا نحكي مو بالسيل. Important cation in generating action potential, plays an important role in fluid, and electrolyte balance increase plasma membrane permeability, helps promote skeletal muscle function, stimulate conduction of nerve impulse, and maintain blood volume and main cation of the extracellular fluid. فإذا بالبلاد بالسيرم الاكستراسيلولار زين وياها هو the main cation هو الصوديوم. المين كاتيون اللي intracellular is the potassium، لكنه بالسيرم التركيز مالته أقل 3.5 to 5. It is important cation in establishing a result resting membrane potential, regulate acid-base balance, maintain intracellular volume, helps promote skeletal muscle function, helps promote the transmission of nerve impulse, and main cation in the intracellular fluid. Calcium تركيز مالته 2.1 to 2.6 millimole per liter بالبلد. Important for clotting factors, plays a part in neurotransmitter release in neuron and maintain muscle tone and excitability of nerves and muscle tissue. Promote transmission of nerve impulse, assist in absorption of vitamin B12 and mainly found in the extracellular fluid. Magnesium تركيز مالته بين 0.5 إلى 1 millimole per liter, helps to maintain normal nerve and muscle function, maintain regular heart rate, regulates blood glucose and blood pressure, essential for protein synthesis and mainly distributed in the intracellular fluid. It is mainly present in the intracellular fluid. الكلورايد اللي هو usual concentration in the serum is 98 to 117 millimole per liter, maintains a balance of anion in different fluid compartments, combines with hydrogen in gastric mucosa, a gland form hydrochloric acid. يسوي حامض الهيدروكلوريك acid, helps to maintain fluid balance by regulating osmotic pressure, main anion of the extracellular fluid. الهيدروكربونز هي 24 to 31 millimole, main buffer of hydrogen ions in the plasma and maintains a balance between cations and anions of intracellular and extracellular fluid, mainly distributed in the extracellular fluid. Electrolyte balance. The body maintains the level of electrolytes in each compartment. The cells, the tissue, the organ, by moving electrolyte into or out of cells based upon the signals provided by the hormones. Okay, it is like water contact. It's very important and in continuous balance throughout the body. If the balance of electrolytes is disturbed, disorders can develop. Some of the conditions that disturb electrolyte balance are uses of certain drugs, especially long-term use of laxative and diuretics, if become dehydrated as a result of use sweating or vomiting, chronic diarrhea, or poor nutrition, or has certain heart or liver or kidney disease, heart failure and liver failure or renal failure. It is if given intravenously fluid, possibly it causes inappropriate amount of electrolyte. Loss of electrolyte can have serious consequences for the body. In severe dehydration, the loss of electrolytes can result in circulatory problems such as tachycardia and problems with the nervous system such as loss of consciousness or shock. Hormones that regulate fluid and electrolytes mainly are three, but other hormones also cause some effect on the electrolyte and fluid. الانتي-diuretic hormone is a peptide that and has its main role to regulate fluid balance in the body. This hormone is produced in the hypothalamus. The aldosterone is a steroid hormone produced by the adrenal glands, which are situated on the top of each kidney. And atrial natriuretic peptide is a powerful vasodilator and polypeptide hormone secreted by the heart muscle cell. Also other hormones possibly نفس steroid hormones كلها ممكن نسوي changes بالاlectrolyte compartments. Hyponatremia is the commonest electrolyte imbalance encountered in clinical practice in healthy individuals. The normal range for serum sodium مثل ما قلنا 135 to 147. In hyponatremic patients, serum sodium level fall below 135. Hyponatremia can be fatal إذا نزلت أقل من 125, and causes of hyponatremia possibly is burns, حروق, congestive heart failure, diarrhea, use of medication as diuretics, which increase urine output, renal diseases, liver diseases, liver cirrhosis, syndrome of inappropriate ADH secretion, sweating and vomiting. Sometimes we need intravenous infusion of fluid. For patients who is dehydrated, intravenous infusion is commenced for rehydration purposes. The fluid is instilled into the vascular space, اللي هو extracellular compartment. Safe administration of intravenous fluid required to understand the role of electrolyte and water in the body, the mechanism of movement between different body concentrations, and how fluid balance is maintained. ولهذا احنا ندرس هذا على ما نعرف انه شلون نستعمل intravenous fluid also. Patients on intravenous infusion may not be able to take oral fluid as a result of their illness. محتمل أنت عنده سبب معين ما يخليه يقدر ياخذ fluid by mouth, ولهذا نحتاج intravenous. The type of fluids to be administered depend on the patient's condition. Regardless of the type of intravenous fluid, need to be aware that when patients are on fluid therapy, they need careful monitoring to ensure that the fluid is administered without complications such as fluid overload. Intravenous fluid can either be colloid or crystalloid. Intravenous fluid to be given either colloid or crystalloid. The colloid solution in practice include albumin and gilvosin, and are also effective for volume replacement in major hemorrhage. Crystalloid for intravascular volume replacement are typically isotonic, مثل normal saline or glucose water. Water freely travels outside the vasculature, so as little as 10% of isotonic fluid remains in the intravascular space. With hypotonic fluid اللي هو مثلا have normal saline زين even less remain in the vasculature, and thus it is not ideal for fluid replacement.